Let's move into exercise. So for somebody that wants to use this as a tool specifically in the insulin resistance realm, what types, how often? Let's really get into it.
Okay, the first thing I recommend is walking after meals, especially a high carb meal. If you wear a continuous glucose monitor, you'll see the power of this in action. So if you can go for a walk, dance, do the stairs, whatever it is, move your body immediately after a meal. 10 minutes, 20 minutes, even if it's just 5. Any movement is better than none because remember, when you're moving, when you have muscle demand for glucose, the GLUT4 transporters will go from inside the cell to the cell membrane so that glucose can come in, so that less insulin is needed to move those GLUT4 transporters because they're there. And that's why, again, eating carbohydrates within 30 minutes of your workout, I call that the golden window for carbohydrates. The GLUT4 transporters are already there from exercise. What carbohydrates you eat will be shunted into the cells without the need for insulin within about 30 minutes of your meal. And that's why I've gotten very strategic with adding like oats in my smoothie after I exercise to replenish my muscle glycogen without the insulin spike. So I think timing the walk after your meals, research really has done good. There's good research behind if you're going to walk for 30 minutes, is it better to do it in 3 10-minute walks after your meals or in one 30-minute walk? And from a blood sugar lowering standpoint, which will also lower insulin, it's better to break it up throughout the day. I think the second thing from a movement, stand. Like I'm using a standing desk right now. I have 4 hours of meeting today and I'm going to be standing for 4 hours instead of sitting for 4 hours. So getting up, moving your body regularly throughout the day. That's where we start. We do not start with signing up for some crazy 8 or 12-week program that's going to be way too intense for your body. Gentle, simple things is what we should be starting with. So the second thing is strength training. And I really recommend at least 2 days a week of moderate to high intensity strength training for all major muscle groups. Now, let's break that down practically. As a physical therapist, my pet peeve was walking into the gym and seeing somebody sitting down with like 3-pound ankle weights on their ankles and doing like these little seated leg kicks. And my favorite quote from geriatric rehab is the only time that we should be having somebody kick their leg from a seated position is if their goal is to kick a ball from a seated position. The caveat there is joint replacements. I do think that there are some benefits. Like if you've had a knee replacement or a hip replacement, yes, do those knee kicks, get the blood flowing. But in general, we are underdosing ourselves and our patients with strength training. Moderate intensity, for very simple terms, means you can't do one more repetition with good form after 12 to 15 repetitions. Maybe down to 10. So 10 to 15, we can call that moderate to high intensity. Moderate. 5 to 10 repetitions to fatigue, which means you can't do another one without good form. That's high intensity. So if we're strength training all major muscle groups at a moderate to high intensity, 2 days a week, there's two primary ways that you can do that. You can either do a total body workout 2 days a week. So we're talking upper body, core, lower body. Functional movements are always going to be more efficient and better. Things like squats, lunges, push-ups, pull-ups, planks. Those exercises that engage more than one muscle group instead of like a single bicep curl, man, that's going to take you a long time if you're just working one muscle at a time to get an effective workout in. So compound movements are going to be best for those total body days. You could also split it. Maybe you have less time and you need to be 20-minute workouts. So Monday you could do arms and core. Tuesday you could do legs. Wednesday can be your break. Thursday you can do arms and core again. And Friday you can do legs. I don't care if people split it up or if they do 2 full body workouts 2 days a week, but it's got to get done. And it is so beneficial for your joints, your insulin sensitivity, your mobility. But people are intimidated to start. And for that, I say invest in a trainer. If you're not comfortable in the gym, if you don't know what to do at home, invest in a trainer. It's going to be a few $100s, yes, but think about the long-term payoff. We always think about the short-term cost, not the long-term return on investment. One of my members calculated, I don't know how she did it, but she calculated how much is it going to cost me to go into a retirement obese. And it was $1,200 a month, Jesse, from like medications, from lost income, from all sorts of factors went into that. $1,200 a month is what it was going to cost her to be obese. So she was, yeah, I'm going to invest in myself now so that I can save that money then. So again, we have to protect our joints. And in order to protect our joints, our muscles need to be strong. If your muscles aren't strong, your joints have to do more work. So people with joint pain, for example, they're like, I don't know what to do. Like, it just hurts so bad. It's like, well, if you don't move, it's going to continue to hurt worse. And there are experts out there that can help you learn how to move within a range of motion that feels good to you. So investing in a trainer, investing in yourself. We have a gym downstairs now that we moved to the farm. It's called a Marcy Smith machine, and I can do anything that I want to do on it that I could do at the gym. So that allows me to be more consistent than driving half an hour to go to the gym. Not going to happen. So then from there, I think talking about zone 2 cardio can be really beneficial. There's 5 cardiovascular zones. Cardiovascular just means heart, like your heart, your blood vessel. A zone 1 is very, very easy. Zone 5 is very hard, all out sprints. Zone 2 is kind of like a light to moderate exertion level. And research has shown that that's really good for our energy production. That's good for our mitochondria. It's great for stress management. So if you're reading the guidelines, Jesse, what you're going to see is 150 to 300 minutes of quote unquote moderate activity, cardiovascular activity each week, right? So half an hour a day. That's a lot for people like that. I don't know if you've tried to reach those guidelines. That's a lot. But at a minimum, I think that's great. It's a great goal. But you can do walking, elliptical, swimming, biking, whatever you want to do. Cardiovascular exercise is important because that works your heart muscle. So a lot of like the resistance training, that's not going to get your heart rate up enough to get those cardiovascular benefits. So both are important. High intensity exercise is more like zone 3, 4, and 5. That's like interval training, high intensity interval training. It's great. We don't want to overdo that because that will kind of spike our cortisol more than what should be desired. So what I see a lot of women doing is just walking. I'm doing pickleball, I'm walking. It's like, okay, great, but where's the strength training? So I think that that's why the strength training should be the cornerstone. And then from there, you can fit in the cardio around your strength training days. But Dr. Ben Bickman wrote a great book called Why We Get Sick on insulin resistance. And he had a quote in there that said, minute for minute, resistance training is better for lowering insulin resistance than cardio. And so there's just ample research supporting the benefits, the efficacy of a well-designed strength training program. So hire a trainer, get yourself comfortable in the gym. I don't care if you don't like to do it. That doesn't matter. Your future self wants you to do this. Your future self wants you to be able to get up from the chair without a lift. Your future self wants you to be able to play with your grandkids on the floor. And get up safely. Your future self wants you to be able to get up if you fall or not fall in the first place. And that requires good muscle strength. Now, the last type of exercise is flexibility and balance training. Also important, that mobility work. And so what I like to do personally is stretch at night, like the first 10 minutes that I'm watching TV with my husband. Instead of crashing on the couch, I stretch. And so if you can work that flexibility and mobility work into your routine, your just daily routine, I think that's a lot better than me like, okay, I have to do this 1 hour yoga class every single Tuesday, which is great for stress management. Great. I'm not anti that. But I think the mobility work is something that can and should be done on a daily basis.
I took notice when you're talking about zone 2, you didn't mention the fact that these exercises are burning calories.
Oh, no.
So because that again is a common myth. People think exercise, the whole purpose is to burn calories. And again, I want to bring calories as a whole into the conversation too. We've touched on it a couple times in the diet realm. So talk about why, when it comes to exercise, that isn't the goal. and then how you feel about calories as a whole.
Okay. So when it comes to calories, I think no one has broken it down the myths better than Dr. Jason Fung in his book, The Obesity Code. He goes through the calorie myth. He breaks down like 4 or 5 things. And one of them being that we have assumed that calories in and calories out are independent variables. And if I eat 250 less calories a day and I burn 250 more calories a day, I will be at a net 500 calorie deficit and lose 1 pound a week. Anyone who's tried that knows that that is garbage and it doesn't work. At least it doesn't work long term. The reason is because calories in and calories out are dependent variables. If you reduce your calories in, say, for example, you're taking Ozempic to reduce your appetite, tell me that you're not reducing your calories out. Tell me that you're not tempted to park closer at the store or skip a workout because you don't have the energy. When your body is so smart, when you reduce calories in, you reduce calories out. You reduce your exercise and your non-exercise activity thermogenesis, or your NEAT, which is part of that overall metabolic rate. When you increase your calories out, you're going to increase your calories in. So I don't know if there's any runners out here, but I'm getting back into running. And especially with that longer distance endurance exercise, that will trigger your hunger hormones. After a run, after you exercise, you're going to want to eat. So calories in and calories out, they are dependent variables. The other thing is, what about the hormonal benefits of exercise? So we know there's research on sumo wrestlers, for example, and when they are exercising hours and hours a day, they're metabolically healthy. When they stop, they're not. And why that is, one reason is the hormone adiponectin will increase when you're exercising, and that will encourage your fat to be stored where it should be stored, in your subcutaneous stores, which is under your skin, not your visceral stores, which is like crowding all of those inner organs. So exercise is so good. Dr. Fung says, exercise is like brushing your teeth. It's good for you and should be done every day. Just don't expect to lose weight. Fact. Absolute fact. So the other thing about exercise, Jesse, is it's a mood booster. It increases your endorphins. It increases your self-confidence in yourself to show up and follow through. It's a great way to express stress in a healthy way, to get that cortisol going, to get the blood sugars that have been raised from the stress, like the cortisol, get those into your cells without the insulin. So I never think about how many calories am I burning, because it doesn't matter. It just doesn't matter. What matters more is, how am I sleeping? How's my stress level? How's my nutrition? How's my general exercise? There's just not a lot of benefit to focusing on how many calories did I burn in this workout. And so I don't like to focus on things that don't matter. And so if that doesn't matter, I'm not going to focus on it. Plus, if you focus on it, you're going to bias your workout towards cardio. Because when you're doing your bench press, when you're doing your push-ups, when you're doing your squats, there's not a calorie counter on the squat machine saying how many calories you burn. And if there is, it's not very many. But if you're walking, you can see that little calorie number go up and up and up. That was strategically designed to keep you on the treadmill longer so you can reach your calorie goal. So calories, they're a unit of measurement created by man for practical purposes, right? Calories do matter, but what matters a lot more is the hormonal impact and overall hormonal balance from your lifestyle. So I'm much more concerned about that than like the strict number of calories that someone's eating. If someone's at a plateau, I might look at their overall calorie intake, but I'm also going to be looking at their stress and their sleep and the quality of those calories.
As you were going through exercise, the other area I wanted you to expand on, you mentioned building muscle will make us more insulin sensitive, which ties into our whole thesis of this conversation, insulin resistance. So talk about how that works.
Yeah, so I like to describe muscle as a garage, and glucose as the cars. The bigger garage you have, the more cars you can fit into that garage. People with low levels of muscle mass can be very insulin resistant. People with large levels of muscle mass, they just have more room to put glucose after a high carb meal before it gets shunted into the fat stores. So I think that's the primary reason. But then the other reason is surface area, right? So not only like more room to store the car, but think of like a big garage. Like I'm looking at my garage right now, there's like an outlet on it. Let's pretend like there's a lot of outlets on the garage. All of those can be receptors for insulin. So there's more receptors so that you can be more insulin sensitive just for the sheer number that you can have more receptors on the cell.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you have a high fasting insulin, if you have excess abdominal fat, if you have high blood pressure, high triglycerides, low HDL, low energy, frequent carb cravings, those are all signs of insulin resistance. Insulin and inflammation are hand in hand.